All right. We got 5 minutes. We'll just let anyone else who's going to join us come on in after that. But hello, everyone. Welcome. My name is Christina Valenti. I am the Senior SDOH Advisor from Contexture, and we are here to present for this webinar of how to meet your milestones and where to find support. So we are going to get started. There's a few little housekeeping things that I want to go over before we get started. The first is I'm sure you noticed when you all joined that we have shut off all of the mics. So that's just to remove any background noise that can affect presentations sometimes. So we just turn those off. We will have options for questions and answer in the last 15 minutes of the webinar. So during that time, we'll allow you to be able to turn your mics on to ask questions. We also are using the Q&A feature today in the webinar. If you can see that on the top bar, the Q&A. So if you have a question during the presentation, please feel free to click that Q&A and enter your questions there. We do ask that when you do ask a question, if you could please make sure you include your full name and the organization that you are from, so that we can one, answer your question, and two, if your advisor is on the webinar with us, they can respond to your questions or reach out to you outside the webinar if it's a more in-depth question. So we are going to get started, and I am joined today with Sebastian Blackwell from Unite Us. So let me fix this in here. There we go. So Sebastian, I'll let you hop on and introduce yourself, and so we can get started.
Thanks so much, Christina. Good afternoon, everyone. My name is Sebastian Blackwell. I'm a customer success manager with Unite Us. I've seen many names I recognized in today's attendance list, so it's good to see those who I have met, and it's great to meet you all. Really, my role on the project is to ensure y'all's success and your rollout of the Community Cares platform. So thanks, Christina, for the opportunity, and I'm excited to show you all more of the tools that you have access to today.
Great. Thank you, Sebastian. So this is just an overview of what we were going to talk about today. Oops, went a little quickly there. And kind of run through. And then, so first, we want to do a little review of the SDOH DAP 2024 milestones. So just so you have an understanding of what the expectations are. So milestone 1, which you've all already completed because you were past that point, right? So it was to sign that statement of work and the Community Cares Access Agreement by April 1st of 2023, which is last year. And then so milestone 2, for any organization that participated in the 2023 year, the requirement was to initiate the Community Cares platform by September 30th, or if you completed a launch plan by December 31st of 2023. And then after you go live, if you participated in 2023 year, is to send at least 10 referrals per month within the platform via the closed loop referral pathway, or out of network or internal cases for each registered access ID. So that was the access IDs that you submitted in that statement of work back in April of 2023. So if you have multiple locations or multiple access IDs, or you signed up individual providers, you're required to send 10 referrals per each registered access ID. And so all of those referrals must be documented and tracked within the platform in order to receive credit for them. But if you're new in 2024, so you didn't participate in 2023, your requirements are a little different. So you are only required to sign that Community Cares Agreement by November 1st of 2023, and then onboard to the platform by April 1st, 2024, which is coming up. So those are the only 2 milestones required for those new 2024 organizations. Okay. And then gaining extra support. So why we're here today. So we have listened and heard a lot from our organizations that they're facing some difficulty challenges in meeting their referrals, whether for various reasons. So we wanted to provide an opportunity to give you extra support, give you a little bit of guidance in how you can meet those milestones. There have been times we can send out information individually or to certain people within your organization, but we wanted to provide an opportunity for everyone to be able to kind of hear our best practices and our ways that we think that you can best meet your milestones. So if you're having any challenges and you're not able to meet your milestones, what our biggest advice is to do is to connect with your SDOH advisor. So that is the person that you worked with, either onboarding, who helped you onboard to the platform, or we had a couple of shifts of who your new advisor may be, but they're this person who's been connecting with you and supporting you during that process. So what they can do is kind of discuss those challenges that you're specifically facing and then connect you with our partners in Unite Us, someone like Sebastian. I believe also Simon and Kathleen are supporting in that. And they can discuss some of any of those workflow issues that you might be experiencing that are making it difficult for your teams to meet send those referrals within the platform. And create a solution together. So our intention is to use the platform. We want organizations to go out on the platform and use it and send as many referrals as they can within the platform, whether it's in network, out of network, in those internal cases, because we want those services to be received by those clients that you serve. That's our ultimate goal, and that's the intention of this program. So that's what we want. I know a lot of organizations have questions about what's going to happen if we don't meet our milestones. What's going to happen? Because there's this incentive connected to it, right? So our goal is not to be punitive. Our goal is to support you in meeting those milestones and coming up with ways to do that. And that's where meeting with your advisor and continually staying in contact with them is going to be the best way to ensure that you're showing that effort and wanting to meet those milestones and get those referrals sent within the platform. So another thing you can do is kind of track your organization's referrals. And this is the best thing to do to understand where you're at. And Sebastian is going to go through kind of how to do these things today. So I'm just kind of setting this up for him. So tracking your organization's referral stuff. We have our data and insights, and you can track if you're an org admin, you can see within the platform kind of how many referrals have been sent. And then also in our Tableau service, we offer it to 3 individuals from your organization to have access to the data site page through Tableau. And you can see specifically how many referrals your organization is sending, even who's sending them, and kind of the response rate, all of the things to get a better understanding of what's happening for your organization. And that's the best way that you can manage and track your referrals, because you're going to be the champion and understanding if you are meeting that mark. And our job is just to support you if you're having difficulty, and then also cheer you on and show our support and excitement if you are meeting your mark and sending those referrals. We want to be able to share that with everyone to say that, look at this organization, they're doing what they need to do. Other thing would be understanding your network. So being able to go into the platform and look at the organizations that are there and see if, one, you have connections with them already and you want to continue to send referrals on the platform. 2, if you see organizations that, maybe you do like to send referrals to, but you don't see them there, we're going to kind of talk about that next and how we can get them to join the platform too. And then, I lost my train of thought, but you can kind of connect with them and understand that network, because that's going to be your biggest way to know what to do to see what's on the platform. And the last thing you do is the thing that we want to champion the most too for our organization is play an active role in expanding your network. because you guys are the ones who are there sending those referrals, connecting with those patients, with those who need those services. And if there's an organization who you normally send referrals to and you don't see them on the platform, one, you can create an internal case to track that referral on the platform for you to meet your milestone. But that also gives us that information of saying, okay, this organization who I'm going to throw out a name, let's say, Banner Health is continuously sending this organization internal referrals or out-of-network referrals because they don't see them on the platform. Well, we can be able to see that information, and our networks team can work to outreach those organizations to get them onboarded. But the biggest way that we can ensure that these organizations are on the platform is by pulling in you all to support and work to help us expand that network. Which takes us into the next place of expanding your network. We have worked really hard to build the network to where it is today, and we are continuously working to expand the network in various areas. So we know that we have a very robust network in our Maricopa County areas, and we're growing that to be pretty big in the Pima County areas. But in those other counties, those networks may not be as robust as we would want them to be because, one, there could be a limited number of resources in that area in general, and two, we don't have connections with those organizations yet. So we want to champion and pull and help connect with those organizations. So some of you may have already submitted partner collection spreadsheets when you onboarded, which you provided names of organizations which you currently send referrals to or you wanted to see on the platform. So we've taken partner collection spreadsheets and pulled all that information, passed it over to our network team to begin outreaching to them. We've seen some success in that and connecting with those organizations. But what we've seen is the challenge in connecting with those organizations who may have contact information with or direct connection with, because they're receiving a cold call. They're really not sure what the platform is. So we want to make sure that what we've seen is the best that has worked is if we have a person or connected with someone who can, we can say, I see Erin's name. So Erin, from this organization is saying, she's on the platform and she wants to bring on, your organization because she wants you to send referrals. So we've seen the best results when that happens. And we also have CBO incentives. So there are incentives for community-based organizations to join the platform. Just like you receive incentives for being on the platform, we have built that in for our CBOs as well. So there's many positive reasons why they can join. And the most important thing is we want to make sure those individuals that you serve are gaining those resources in your area. And the other option we have is some organizations have championed expanding their network, and they have actually hosted community cares information sessions for some of their community partners in their areas. And what this looks like is they they hold an event and invite their partners in, and we come in and we present the information about the platform, how to join, and work with them to onboard. So those are just some of the options that we have. And I'm going to pass it over to Sebastian to kind of go into the platform overview and the demonstration of how to meet your milestones in that data piece. And then, so Sebastian, over to you.
Thank you so much, Christina. We can head to the next slide. Awesome. I know this is going to be a review for most folks on the call today, as you all have been on the platform, but wanted to highlight a couple of slides at the top before we got into the actual demonstration. Our goal with Community Cares and on the Unite Us platform is to create essentially an infrastructure to collaborate to serve clients in our community. So I'm from Arizona. I come from the case management background, and I have provided resources to folks I've served for a long time. And oftentimes it looked like we see on the left-hand side where it says before, where I would give someone a resource and I would lose that visibility into what happened. And our goal is to mediate that or mitigate that concern and go to that after that you see on the right, where we can all collaborate together and have that outcome data that Christina was describing in order to provide the most comprehensive care addressing folks' social determinants of health needs. So that's why we're here today. I wanted to ground the demo in that. And we can head right to the next slide. As you all know, our goal is to, as we shared, to create that unifying infrastructure between healthcare entities, government entities, and community-based organizations. The system, as you see it in the demo, will allow you to conduct screenings if you choose. Although not a requirement at this time, you are able to administer social determinants of health screeners within the platform. Of course, electronic referral management is at the heart of what we do. You're able to use this system to manage those referrals into the community. And then also that bidirectional communication piece is crucial. I saw someone in the chat indicate, they've had an org who they've not been able to connect with. We really hope that the system, and I'll show you how, allows you to create those connections with folks in the community. And then of course that outcome tracking. So you know what happens to your patients as they leave your four walls into the community when you're making those referrals. We'll go right to the next slide, Christina. This is what I'll show you in the platform, but sometimes it's a little bit easier to see it in a visual sense. So I'd like to show you and follow the journey of Tom, who you see on the far left side of your screen. So you can imagine Tom is a member of the community who has maybe some social determinants of health needs. Perhaps Tom is experiencing food insecurity. So Tom has a primary care appointment or is working with a provider. Her name is Sue. Sue, through either social determinants of health screening or through conversation, has identified that Tom has that food insecurity need. So then Sue is prompted to launch Unite Us, as I'll show you today, and connect Tom to a resource in the community. She's able to capture his consent in the platform, which is required. And I'll show you how that looks, of course. But Sue is able to locate organizations in the community near where Tom is living to meet Tom's social care need. Once Sue identifies a resource, she's able to push a referral through to the community organization. On their side, they'll get an email notification that Sue from the primary care office is attempting to send Tom to their agency. They accept that referral and then call Tom in to provide the service. After the service is administered, that agency can go back in and indicate a resolution. Meanwhile, Sue is notified via email along the way of Tom's progress. So that's really our vision for our work. And that is the closed loop referral that Christina described. Also want to highlight here that Sue would have the option to share a resource directly with Tom. We've also, of course, partnered with Arizona 211, operated by Solari, and ingested their resource directory into the system. So if you are in an area, as Christina mentioned, that's a more rural area of the state, there are many resources listed in the 211 directory that are available for you today in Unite Us. And Sue could share that resource directly with Tom and indicate the outcome if she knows it. That's called an out-of-network case, and I'll show you that in the platform as well. So this is a visual of what I'll show you today. Move right to the next slide, Christina. Awesome. Also want to highlight here that you all have access to Unite Us Insights. This is a premium product that the Community Cares Network is supporting for you all, and that is essentially visibility into the data that your team creates. As Christina mentioned, you all get access to 3 licenses to the Insights product, and if your team has not accessed yet that product, I'm going to drop a link in the chat. This is a form where you can fill out and indicate those 3 users that you all would like to give access to the extended data. I'll show you today, but ultimately this is the best tool that's at your disposal to help you track where you are regarding your SDOH DAP milestones. So want to make sure that you know, of course, it's your data. We hope we use it to tell your story. The system will allow you to track your organizational activity. You can see how many referrals you've created, how many off-platform or out-of-network cases that your team has built. And then ultimately, we can use this data to, as it says, inform community reinvestment decisions. The idea is we can see the gaps. We can see if there's a particular service type, for example, that folks' needs aren't being met under. So this data is really powerful, and we really hope that you all fill out the form that I indicated in the chat to make sure you access that data. We can go to the next slide, Christina. The primary product that you all will get access to in Tableau is called the Network Activity Dashboard. That's what I'll demonstrate for you all today. The Network Activity Dashboard allows you to, one, evaluate the network coverage. This lets you know how many organizations are there in the platform and for what service types within my county. You can also get a snapshot zooming in on your specific data. You can see the number of folks you've served, the number of referrals you've generated. You can follow those referrals through their journey to see how many of those referrals have led to a resolved outcome. So it's, again, super powerful data. I did see someone indicate in the chat that they don't have access to Google. No problem at all. I would just encourage you to reach out to your SDOH advisor, and we'll make sure you get those licenses that you need. Great. And we can go right to the next slide, Christina. The Health Equity Dashboard. This is another dashboard that you all have access to. This allows you to look at demographics across the county or even zip code level. The primary difference between the two dashboards is the network activity you can narrow to your organization. The Health Equity Dashboard, the most narrow we can go is by zip code. But again, super powerful information that we're taking out of the platform that you all have access to, where you can see how are folks being served in my county or in my zip code, and are we seeing folks being served equitably across different demographic groups like gender, race, ethnicity. So really, really exciting data that when you fill out the form or connect with your SDOH advisor, we want to make sure your team has access to. Right to the next slide, Christina. The other way that you all can monitor and track towards your milestones is through Unite Us in-app exports. This is what's available within the Unite Us platform itself to organization administrators. So as I mentioned, Insights, you all will have access to 3 licenses across your organization. The in-app exports, this is based on user role. So if anyone is listed as an organization administrator, they have access to the exports today. Great. I'm going to move next into the demonstration portion of today's presentation. Our goal is to show you all how you can meet those metrics. So really going through how to generate closed loop referrals, out-of-network cases, and internal cases. Those are the activities within Unite Us that you must conduct to meet that milestone. So we'll start there. Christina,
And then
you can borrow the screen.
Hold on, yeah, and then I'm going to stop the recording because of Unitus's proprietary and licensure of their product. They don't allow recording of their platform, so we will have the recording available to you, but so we just have to stop this portion right now.
Thanks so much, Christina.
So next step. So the best thing that you can do, and what we've been saying this entire time, is connect with your SDOH advisor to provide you that guided support for your specific needs. The email addresses and names of all of the SDOH advisors are listed here on the screen. If you're not sure who your SDOH advisor is, please feel free to contact the Community Cares inbox, and then we can direct you to your SDOH advisor through there. Let's see. And then now we're going to take the time to answer any of the questions that you have. Everyone is on mute, but if you raise your hand, we can turn your mic on so that you can answer any questions. And then we can also run through any of the ones that we may not have answered in the chat. So also tag my partner Ariel from Contexture to highlight any questions that we may need to run through that we didn't hit in the chat. So does anyone have any questions? Play. All right, Clay, you should be able to be come off mute.
Yes, thank you. I actually typed it in the chat. I just wanted to know, is there a way for us to know who, if we've already submitted the form for the insights data portion, and how are those different from like the oversight admins? Is that just pulling raw data from the platform itself?
I can take that. We're happy to let you know if your team has already submitted for that insights request, but the insights request, that form that I dropped in the chat, that's to get access to that Tableau product that I showed at the end, where you can see the roll up of data. This is totally distinct from those that you've identified as org admin for exports.
Okay, great. Yeah, we'll just follow up and see if we've added people already and go from there. Thank you.
Thank you. All right, and then I see Sarah. Let me turn your mic on, or allow you to turn your mic on. You should be able to now, Sarah. Come off mute.
Hi, I also asked my question in the Q&A. I've been running into a problem with the internal versus external referrals insofar as we have a couple of programs that either programs or service modalities or things that we offer that are very new to us, so we don't accept external referrals for them. So they're not actually listed in our programs in Unite Us, so we're not able to send internal referrals for them. Is it a problem that we've been using the external referral function? Or is there something else we should be doing specifically to document these as internal referrals?
I think I can take a stab at that, Christina. Sarah, I think I understand your question. So it sounds like, and currently from like when you're sending referrals across your organizations, you might be using the standard referral functionality rather than that internal case functionality. From my perspective, I think that that's totally sufficient, especially if you're going from one technical location to another. That's an opportunity. You also have the option within your organization settings. I can show you in the platform. This I think is helpful for everyone too. Within your organization settings, you are able to add new programs. So I hit the building icon, organization settings, org profile. You can add new programs, or you can turn off referral receiving. So that's just something for you to consider. You may want to add a program, turn off external referral receiving, and it would still appear within that internal case workflow. And this would prevent external organizations from referring to you, but you'd still be able to do it within your one location. So that's kind of two-part answer. No problem at all sending from one location to another through the standard referral workflow, but you also have the opportunity to add programs and create those internal cases if you choose.
Thank you, Sebastian. Any other questions?
Hey, Christina, there's a couple questions in the chat, I think for Sebastian. So Annie Melzer from the Guidance Center says, we have 6 organizations within our company. Does the Insights tool combine this information?
It can. So within the Insights platform, under originating organization, when you add filters, you have the option. So you can look at one location at a time and hit apply, or you can multi-select all of them and it will roll that data up together. So, it's kind of the value of being set up in the way that you are, because you can look at referrals sent by location, or you can look at an enterprise as a whole.
Another question we have, I think is related to Insights, is from Suzanne Legender. Says, does it show which team members made the referrals? So are you able to see the referral at the staff detail?
That's a great question. Within the Unite Us Insights platform, you are not. You will not see staff member names. Within the Unite Us tool itself, however, you can go to the outbound referrals and filter by specific staff members. Or if you pull the export for referrals, you'll see the team member's name that generated that referral.
Any other questions, Ariel, that we might have missed in the chat?
Yeah. Searching here, I think we have a question from Allison. Can you show us how to accept a referral? We have received referrals, but not sure if we have gotten credit for scheduling an appointment via Unite Us.
I'm happy to highlight how to accept a referral. I will share though that receiving referrals is not one of the activities that counts for those 10 a month for SDOH DAP. It is an important feature. Definitely want to make sure patients get connected to your services, but I just want to add that caveat around the credit piece. But definitely highlighting, when you get those referrals in, your team will get an email if they're assigned to the program that they're referring to. But you can always go to the inbound referrals, that's your inbox,